Welcome to Introduction to Clinical Departments and Support Services. If you are watching this video, you may be new to healthcare supply chain. As a healthcare supply chain professional, you will interact with many different departments throughout the day. You will learn about what services some of the common clinical departments provide, as well as what other support services departments offer. Let's jump into it. This video is presented by Trident Edge Consulting, where it is our mission to provide thoughtful instruction, tips, and guidance on healthcare supply chain topics to passionate supply chain professionals just like you. One of the first places a patient might visit at a hospital is the emergency room, or ER, for an emergency or accident. The emergency room treats everything from broken bones and high fevers to heart attacks and car accidents. According to the CDC in 2018, 40 out of every 100 people went to an emergency room for treatment. It is the first place a lot of patients go to prior to being admitted for inpatient treatment. There are many administrative clinical support departments that are critical to hospital operations. Some of these departments include the Admissions, Discharge, and Transfer, or ADT department is responsible for the flow of patients into, around, and out of the hospital. They ensure that patients are taken to rooms that are ready for a new patient, move them to a step-down unit when medically appropriate, and assist with discharging them home. The Scheduling department will contact patients to help schedule, reschedule, and cancel patient appointments. They also may collect pre-admission information such as allergies and any known complications. Most hospitals have a nursing administration team that provides leadership, guidance, and has decision-making authority to ensure quality care is provided to all patients. The Nursing Education Department is critical to ensure that nurses are prepared to treat patients with a wide variety of illnesses, provide leadership, and provide safe quality care to every patient. If you have ever had to stay overnight at a hospital, you are placed in an inpatient unit. During this time, you are under the medical supervision of the nursing team and doctors. There are many different types of inpatient departments in a hospital. Each has nurses and doctors that are specialized in treating the specific type of care that each patient needs. Not every hospital will have each of these departments, so you should familiarize yourself with what is at your hospital. The Cardiology department provides care for patients with heart or blood circulation disorders. The cardiac cath lab is where doctors perform minimally invasive tests and advanced cardiac procedures to diagnose and treat cardiovascular disease. The intensive care unit, or ICU, or the critical care unit, CCU, provides intensive treatment for patients with severe and life-threatening illnesses or injuries that require constant monitoring by nurses and physicians. Patients may also be placed on these units after surgery. In an oncology department, patients receive treatment for various forms of cancer and tumors. This may also be called the Cancer Treatment Services or Center. The neurology department provides treatment to patients with nervous system issues, including the brain, spinal cord, and nerves. When giving birth to a child, patients are taken to the labor and delivery unit, or L&D. Physicians and nurses provide antenatal care, deliver babies, and provide childbirth care and postnatal support. The Med-Surg department is for patients who are preparing for or recovering from surgery. The operating room, also commonly known as surgical services or perioperative services, is one of the largest departments in any hospital. Sometimes it can be quite chaotic in this area due to the urgent nature of the care that is provided. This is also one of the departments that the supply chain department commonly interacts with. Some common types of operating room or OR rooms include general surgery, which provides a wide range of surgeries and procedures. Trauma OR rooms treat patients that have critical, life-threatening injuries. Neuro OR rooms will complete operations on the brain. An ortho spine OR room treats patients with injuries such as broken bones and torn muscles, as well as surgery on the spine. In the cardiac OR room, physicians will perform various surgeries on the heart, such as heart valve replacements, repairing aneurysms, inserting a pacemaker, heart transplant, or open heart surgery. If you hear the word hybrid in relation to the operating room, this means that in addition to the typical surgical equipment in the room, there is also imaging equipment, such as a CT or MRI machine, that can be used during the surgery. Each of these different types of operating rooms treats hundreds of thousands of different types of surgeries. Some of the terms you may hear associated with surgeries include colorectal, general, hand, foot, and ankle, joint replacement, neonatal, neurological, obstetrics and gynecology, ophthalmic, oral and maxillofacial, orthopedic, otolaryngology, plastic, spine, sports medicine, thoracic, trauma, urology, and vascular. There are also additional clinical departments in a hospital that are designed to provide specialized support to the physicians and patients. The anesthesia department provides and oversees the administration of anesthesia for patients who require it for their procedure or surgery. Respiratory therapy conducts, performs, and analyzes diagnostic and functional tests to assess lung capacity and capability. They will assist in the creation of treatment plans and provide treatment as necessary. The pharmacy is responsible for the management and distribution of pharmaceuticals. Radiology performs imaging on patients such as X-rays or CT scans. There is also a specialized part of the radiology department called nuclear medicine that uses very small amounts of radioactive materials or radiopharmaceuticals to examine organ function and structure. The pathology department analyzes and performs tests on blood work for patients. You may also hear this department referred to as lab or clinical lab. The dialysis department provides treatment to patients with kidney issues. Outpatient departments include the practices and clinics that a patient visits without being admitted to the hospital. These departments may be physically located at the hospital or at an off-site location. Some of the common outpatient departments include internal medicine, which focuses on prevention, diagnosis, and treatment of conditions that affect the internal organs. Interventional radiology, which uses imaging machines to diagnose and treat diseases. Depending on the size of your facility, IR services may be provided during an inpatient stay. Obstetrics and gynecology, commonly referred to as OB/GYN or OBGYN, provides care and treatment to the reproductive system and to women during pregnancy. Dermatology provides treatment for skin diseases or illnesses. Occupational therapy, or OT, provides therapy to patients to help with regaining the ability to perform daily activities safely and efficiently. Physical therapy, or PT, helps patients manage pain and improve movement problems. Endocrinology provides care for patients with hormone-related diseases and illnesses such as diabetes and thyroid-related illnesses. Behavioral health, psychiatry, clinical psychology, and counseling all provide comprehensive mental and behavioral health care. Each of the clinical departments are supported by numerous non-clinical departments, including supply chain. Your supply chain department may include materials management, purchasing, contracting, receiving, mailroom, print shop, and central sterile departments. The supply chain department interacts with almost every other department in a hospital in one way or another. We will discuss some of the ways that supply chain interacts with them. Biomedical engineering manages and maintains medical devices throughout a hospital, such as pumps and billy lights. Supply chain may stock the medical devices in clean supply rooms or help deliver them. They may also help to collect soil pumps from clinical departments. Environmental Services is responsible for the overall cleanliness of patient rooms and common areas throughout the hospital. Supply chain may assist with the coordination of the ordering and delivery of specialty beds needed for patients. The Food Services Department focuses on food preparation, production, and delivery to patient rooms, as well as to visitors in the cafeteria. While supply chain does not assist with the actual preparation of the food, they may help with the procurement and sourcing needs of the Food Services Department. Finance and accounting works closely with the supply chain department to ensure that financial records are accurately reported, such as during a physical inventory. Value analysis helps health organizations reduce costs and improve the quality of the products it uses through various assessments. Revenue cycle maintains the charge codes that the patient billing department utilizes to charge patients, verifies that billing is appropriate, and works with insurance companies. When a new product is introduced through the supply chain department, revenue cycle has steps that they must take to ensure that the patient is charged appropriately. After a new product is brought in by supply chain and revenue cycle has created a new charge code, the patient billing department ensures that supplies are charged to the patient appropriately so that the hospital can recoup costs incurred. Information technology is typically a close partner of the supply chain team. The IT department is heavily involved in the ongoing maintenance of the ERP system and other systems that are used to support daily operations. Supply chain and accounts payable work closely to ensure that invoices are paid appropriately. If the PO and the invoice do not match for the item, quantity, or price, both departments will research the cause of the discrepancy and work to fix it. Project management is responsible for the overall success of many projects each year. They will engage supply chain for purchasing and contracting needs, especially if it's a capital project. Maintenance typically works closely with supply chain to plan equipment needed for a new space or new building and to place orders for capital equipment. In addition to the departments we just covered, there are many other departments that supply chain interacts with. During your daily operations, take note of how many departments you interact with. Supply chain is ingrained in every department, whether it's consciously thought of or not. As you can imagine, it takes countless specialties and skills to keep a health system operating effectively. Each role in every department is truly critical to the entire system. At the end of the day, it really is important to reflect on the fact that you are part of the patient-focused health system and that you are personally affecting the quality of care and the overall experience of the patients at your organization. Thank you for listening to the end. We certainly hope that you have picked up some practical knowledge today and that you have a stronger understanding of the organizational structure and the departments that commonly exist in the hospital setting. If you enjoyed today's video, please like and subscribe so we know that you would like to see more of this specific type of content.